Okay, well, welcome everyone. Thanks for joining us at the Montana Chamber of Commerce. I'm pleased to introduce Mark Springer, who is the president of Dayspring Restoration. And this is a good Montana news story. Mark's dad actually started this business in his garage back in the late 80s, and it's continued on with Mark taking on the role as president. And so it's great to have a good chamber member with a strong Montana background doing good Montana work. And so I'm pleased to have Mark Springer here with Dayspring Restoration. And I think Mark has some real interesting perspectives to bring to us, because not only is he the president of Dayspring Restoration, but he's also the president of the Restoration Industry Association. It's a national trade association that works on restoration issues. And that association group on a national level has really been working very closely on trying to interpret CDC guidelines and OSHA guidelines and provide feedback on how those guidelines can work in the real world and in a business situation. And so Mark's been in the middle of that, of those discussions, and he's here to bring some of those insights to Montana on how we can prepare to reopen businesses in the state, and not only reopen businesses, but how we can stay open as we're expected to see some spikes and some reemergence of the COVID, possibly this summer or maybe even into the fall. And so with that, Mark, thanks for joining us. Look forward to seeing your presentation and taking some Q&A on some of the issues that are on folks' mind today.
Yeah, absolutely, Todd. Thank you. And thank you for having us. And we feel so fortunate to be operating a business in Montana. Our company, which is a disaster restoration business, operates across 6 of the major cities in Montana. And we have about 130 folks on our team across the state. And that has provided for us an interesting vantage point through this COVID-19 crisis. Because we've been working all over Montana. And not only has it provided a good context or framework for us to kind of see how Montana is dealing with this issue, but also, as I mentioned, with the role that I have in the Restoration Industry Association, I've been able to see how things have been approached and how they've been dealt with, not only in the United States, but around the world. The RIA, Restoration Industry Association, has members from around the world, and but the main kind of concentration of members is here in the United States. And in that capacity and in that role, our industry's been very challenged because our industry consists of a lot of first responders. We're the folks that were considered an essential business according to, there's a lot of businesses that are essential, but I think most people would be able, as they think about this sort of disaster restoration service, to go, oh yeah, if a building floods or has a fire in it, it's really important and imperative that that be dealt with really right away, because it would get a lot worse if it sat there until this shelter-in-place order was passed. So we've been working and dealing with all of the challenges across Montana here now for the last 8 weeks. And actually, there as early as February, I started in the industry role that I have, started getting information and briefings from groups like the CDC and NIH and WHO and NIOSH to kind of forecast what we were going to face. And at that point, I almost didn't believe it. It seemed unbelievable to me that what we were going to face was going to be, they were talking at one point about 50% of the population contracting COVID-19 and there being millions of deaths. And I didn't even talk to my wife about a lot of this stuff because it was kind of troublesome initially, and not a lot of it wasn't even in the news yet. And I'm sitting there thinking, okay, so if that percentage of people are affected, like I'm gonna have people in my business that catch this. I could have people that work for me right now that we lose. And that was pretty unbelievable and eye-opening. The good news is that these really grim forecasts, and a lot of these models that have been putting projections out have been proven to not be accurate. So that's a positive news, and that's why here in Montana we can talk about things like right now here in April and getting back to work in Montana. But the key thing, and I hope the thing that folks will be able to take away from this webinar that we have today, is that we can open up in Montana, which is one of the very first ones in the nation to open. We can do that, and we can be successful in this reopening if we do it in an organized and sensible way. And really what we want to be able to convey to Montana Chamber members today are some really good things that we have learned, and some hopefully helpful information that will aid and guide businesses in doing this in a way that doesn't result in more problems down the road, where we talk about maybe a second wave coming or another reignition of this virus at some point. We would certainly hope that Montana could be a model for states in how they reopen, and the sort of way, the sort of approach that we use as we go into this. So as we pull this together, we pull this information together for Montana Chamber of Commerce members, we really wanted to have a framework, and we talk about these 4 Ps here within this framework that hopefully will give a few things for Montana businesses to think about as they contemplate the process they go through for reopening. And so the very first step of this is to prepare. And I know that right now everyone wants to be able just to get back to business. They want to put their employees back to work and really stop the bleeding that they're feeling right now in their businesses. But it's important that, and again, these come from not just my thinking, but again, just this really wealth of information that we've been exposed to now over the previous months. And it's really to make sure that you have a preparedness and response plan. And I would highly recommend that members put this in writing. If it's put in writing, it's much more likely that it's going to happen. And there's really some key assessment points that should be addressed as a business looks at this issue. The very first one that they should look at is the exposures that they have that are unique to that business. What are the exposures that they have? Where are they happening? And how are they happening? So again, speaking to my business, the way we had to look at our exposures, we're sending our employees out into people's homes, out into their businesses. They're coming in contact with people out in their homes and businesses in a different way than many other businesses may do that. If you are operating an insurance agency or a accounting firm, it's going to be very different from your business. But the very first starting point is conscientiously thinking through, how could exposure happen here? If you don't think that through as a fundamental or foundational point, then all of the rest of your planning is really going to suffer. So that's really important first step. The next step is to look at what are the factors, the risk factors that I have within my own workforce. Now I understand Montana, the average Montana Chamber business probably has fewer than 10 employees. So the assessment probably is something you're going to be very close to. You're going to know with your subset of employees what their risk factors are. But it's also really important to ask and to engage in conversation about this. Now, again, we can provide this information. We've already talked with Todd and Matt about providing this information and these resources to Montana Chamber members after this webinar. But the information about who is at risk is readily available. It's readily available from CDC and OSHA, and a lot of places those resources are available. Here I have a picture of a young woman who has asthma. Now, a lot of times people would think, oh, young woman, this girl here looks like she's probably in her 20s or early 30s. No, she's not at risk. Well, if she has acute asthma, she probably is at risk, and she is someone that you should take special precautions for as you bring her back into the workplace. And there's a lot of different different risk factors that people should be looking at. When you looked at the risk factors initially, you probably looked at them through the lens of, do my kids have that or do I have that? And you probably weren't thinking, does the person who I have as a teller or a receptionist or my maintenance supervisor, whoever it is, do they have those risk factors? So that's really an important next step, is assessing the risk factor of your team. The next one is really to look at ways that you can control this risk. Now, we've seen little X's and little boxes all over Montana. We see them in Costco. We see them in Home Depot, where they are promoting social distancing. Now, it's one thing for us to look at that for our customers, and being customers when we're walking into businesses, that's the way we think about it. But it's probably more important for us to think about the risk and the control of risk as it relates to our team, because that's who we spend time with. That's the people that we come into close contact with. And so looking at ways that we can control this risk is a really important next step. And then the last step of this preparation phase is contingency planning. Now, there's some contingencies that we faced in our business that I never thought we'd have to deal with. And I think probably every other business, we had to figure these things out on the fly. Every other business that deals with this, you can probably have a little a less steep learning curve if you can anticipate some of these things in advance. And the reality is this: you're probably going to see some absenteeism that you didn't have to deal with before. We know that some people are having to deal with childcare issues that they didn't anticipate, or they have a sick family member that they didn't anticipate, which means this: it means you're going to have to cross-train your teams, and you're going to have to anticipate interrupted supply chains or delays, whether it be with your product or your material or whatever you're looking for as the key elements of your business. And you probably will need to identify or look at backup for some of your administrative services. Okay, so this is your intake, this is your payroll. Imagine this: the person who's your payroll clerk tests positive for COVID, or their wife tests positive for COVID, or their husband tests positive for COVID, and they can't be there. Do you have a plan in place as to how you would deal with a backup for that, especially if your business only has 10 employees? The other 9 people probably aren't going to be okay not getting their paycheck. So looking at cross-training and backup plans for these sort of situations are important. Certainly they were things, again, with our team across Montana with 130 employees, we dealt with backup issues, cross-training, and figuring out how we deal with unique circumstances almost every day over the last 2 months. And this is one of the real challenges with this. Everything changes quickly. We find that what we deal with today probably isn't going to be our reality tomorrow. So those are some really important preparation steps. Now, the next piece is looking at your policies. Now, within your policies, the first thing that I would say is you need to start by looking at all of your existing policies. Your existing policies probably do not anticipate or deal with a lot of the issues that we are facing with COVID-19. And so I would recommend that every person who's a part of this call take their current employee manual or team handbook and look at that through the lens of how is this affected by COVID-19? Here's some practical examples that we had to deal with. Our sick leave plan and all of our policies for sick leave, they had to change. Now, again, you're free. We created all this stuff. A lot of this stuff we created from scratch because we had to deal with it 6 weeks ago. I'm more than happy to provide this stuff to the Montana Chamber members as a resource. If you want to steal what I have, feel free to use what we've already done the work on. If it helps someone out, I've got no problem with that at all. But this is one example of things that you will need to look at. The other things are just your basic protocols within your business. Another one that we're going to talk about a little bit later is disinfecting protocols. So how do you disinfect your business? I know some people are concerned about the legal liability with disinfecting, but it's probably a bigger risk to not disinfect than it is to have a disinfecting protocol. That would demonstrate really a proactive and prudent approach to reopening within our businesses. And so how do you do that? How do you execute that? How do you accomplish that? Well, here's a protocol that we use. And it's really important that if you are doing this internally, that you follow a process or a protocol, or you have your janitorial company use a protocol, or whatever company you hire, whoever the third party may be, they need to be able to demonstrate that they have competence in this. Otherwise, you're probably wasting your time and money. Other things, here's just one other example, and we're hitting this from a really high level. We could spend an entire webinar talking about policies that we have had to implement in our company over the last 60 days. Here's another one. How do we discontinue home isolation in the case of someone that gets sick? So it's likely that we're still going to see people that get sick. So how do we bring these people back into the workforce? How do we bring them back into our organizations without risking that other people get sick? So here's another example of policies that are needed and are going to be helpful as we move into this reopening in Montana. Now, once our preparation is complete and we have policies in place that support that preparation that we've done, we then need to present this to the stakeholders in our business. And there's really two that we focus on, our internal and external stakeholders. So our internal stakeholders are the people that are on our teams right now. These are the people who are frontline servicing our customers or key to our business operation. And then we have externally our customers. Really the key, and Todd and I have talked about this as we think about what are the most important pieces here. Really the big and most important piece is building confidence with the end user. If the end user, if our customer and the consumer across Montana has a level of confidence that you are handling this seriously and thoughtfully and with a bias of their protection, there is going to be a greater degree of success, and it's going to be easier for us to overcome the fear that we face. But this has to be clear and it has to be frequent. Now, internally, I'm just going to tell you, and by the way, any of the stuff I talk about that we're doing, I'm not saying that we are perfect. I'm not saying that it has not been without areas of failure, because we've learned it as we go. But what we have done is we have found some really helpful and useful things that we do internally. First of all, we communicate with all of our team. We got all these new policies and procedures. We communicate once a week in a Zoom call that's recorded and then posted on our HR platform so that our team can go back to it and reference it. If anyone misses it, they can get it. But once a week, we're talking with the whole team, every single person in our organization. And then daily, our entire leadership team from across Montana, all of our regional managers, our CFO, our HR director, our logistics managers, everyone gets together on a call once a day near the end of the day, and we talk about the really critical issues that are happening in our business. Do we need to develop a policy for this? Like, this issue just emerged. What is the policy we need for this? And then other things that are really critical right now, I think for our organization, one of the things that's really critical is cash flow. We have a customer, an end user that's facing unprecedented financial challenges. So how do we support that? How do we work with that, but still be able to pay our bills, pay our employees, and work through this process? So that's something that we get laser focused on, and it happens every single day. So that internal communication, absolutely critical. The next piece is external communication. Again, this gets to the issue of building confidence with the consumer. The consumer needs to know, here's what we're doing, or here's what we've done, here's what we're doing, and here's the routine at which we're doing it. I just took a screenshot from what we are doing, what is our response and disinfection protocol for novel coronavirus, COVID-19, in this pandemic that we're in. And we're telling our customers, here's what we're doing to protect you. Now, some of these steps probably seem to some people to be overkill, but I tell you, as more and more and more of this pandemic really escalated, people started to really appreciate the way that we were handling it. And that's why our business was able to move forward and not to have really negative or detrimental effects. But the external communication, there's a lot of ways to do that. There's websites, there's social media. There's certainly things like constant contact where you can stay in touch with your email database, but really strongly urge external communication as well. The fourth P is procedures. What are the procedures that we need to have? Now, one of the things that we've seen, and this is just a poster that one of the gals in our office, Grace Greer, put together, really a handy, it's a visually appealing poster that we post all over all 6 of our branches. I mean, it's everywhere. We wallpapered with this thing. And it's, what I've seen is that some businesses have this really sterile communication about how we can prevent this virus from spreading. I mean, they have a little, typed up paper that really doesn't say much and eventually just gets ignored. So however you communicate, we just provided this to the Chamber of Commerce to put their logo on, and they can send it out to everyone to use. But really, we want to make sure that we keep the most important processes in front of our people. We train them on these pieces, okay? We don't just say, wash your hands. I mean, it may seem silly, but we actually put on our LMS a video about how you properly wash your hands. There's a proper way to wash your hands and an improper way to wash your hands. Just running them under water for 5 seconds is not properly washing your hands, and it's not going to deactivate the virus. So for each of these pieces, really critical. Now, I would just want to draw everyone's attention. I know our time is limited today, but I really would like to draw the viewers' attention to 2 items on this here that I think are 2 of the most critical. The one in the bottom right is really, really important. Stay home when you're running a fever of 100 degrees or greater, okay? The key here is if someone gets sick, we want to isolate them. We want to quarantine them, get them out of a place where they can transmit the virus. And so making sure that you're going to have a plan in place to support them when they have this. There's a lot of different programs available to deal with this, but it's really, really critical that people understand if I get this virus, I can't be here infecting other people within this building or within this business. The other one that is really critical is the top right, clean, frequently touched surfaces. Now, this is not only cleaning, but cleaning and disinfecting. I would highly recommend that every single business who has a janitorial service that they're using to come into their buildings and dump trash and clean bathrooms, that they expand the scope of their services to include a disinfection protocol. Now, it's really important. Again, we can provide this information after so that people can go back and find this information. It's absolutely critical that they are using an appropriate disinfectant that's on the EPA List N. List N is approved for the SARS COVID-19 virus. And what's really important is that not only are they using a disinfectant that's on that list, but also that they're using it according to the label instructions. Now, a lot of times folks are doing disinfecting services and they're really not doing any good. And unfortunately, the business who's trying to do the right thing is wasting their money. And so how is this done? I'm just going to give a 4 examples. So take bleach, for example. Chlorine bleach is actually on List N. Now, there's some negative sides of using chlorine bleach. If someone uses chlorine bleach on a surface that it's not intended for, it can remove the color from it, or it can oxidize the surface. But if they did use bleach, if they were to simply mist the surface down and then wipe it off, let's just say 3 to 5 seconds later, that surface has not been properly disinfected. In fact, for chlorine bleach to be effective and to actually deactivate the coronavirus, it has to be on the surface for at least 5 minutes. Okay, the dwell time required, according to the label instruction, what's been tested in laboratories requires 5 minutes. Now, there's actually even one more step that's important for that. Before the surface, if the surface is dirty, it has to be cleaned first to remove what's called the biofilm. And then after that, the disinfectant can be applied and be allowed to have enough dwell time to deactivate the virus and then be wiped off. Now, if the service that is doing this is not doing it properly, then really all that's left is a false sense of security. Now, what we recommend is that businesses that are opening, that they clean these surfaces frequently, which means more than once a day. At a minimum, they should be cleaned once a day, for sure. But I would recommend at really a bare minimum, twice a day, morning and afternoon. A lot of businesses are dealing with this hourly, but the key is make sure that there is someone who is assigned to this duty. If you just say, hey guys, we're all going to chip in and we're going to disinfect our surfaces and clean the surfaces, it probably isn't going to happen. And so it requires a lot of vigilance, and it requires someone who has actually been specifically delegated that duty. Those are 2 of the ones that I would say are really, really important, but all of them within the context of maintaining distance and just good hygiene will help. And hopefully this tool will aid a lot of people in our getting back to work. Getting back to work here as a state is really important. There's a lot of people that are hurting right now, that are out of work, or they're really concerned and fearful. But if we implement these things, if we take these steps and we implement them according to the needs of our businesses in a way that's systematic and regimented, we'll get through this. And we hope that these things will help you in that process. Todd, I hope we hit the big highlights there. Is there anything else that we need to cover here from these resources? I know, again, we're hitting it from pretty high level. And Todd, just so you know, you are muted.
Can you hear me now?
Yes, you're unmuted now.
So let me ask you, Mark, on the 5-minute piece there. So can you give an example of how you would clean surfaces, trying to adhere to that 5-minute? You'd wipe it, you'd spray it, and then you'd go about, do some other cleaning, and then come back after 5 minutes. Is that how you would recommend doing that to kind of follow in line with that 5-minute protocol?
Yep. So just the surface would need if you're using bleach. Now, all these disinfectants have different dwell times that are required. Some of them have as little as 30 seconds. In our company, we use a technology that is made specifically for very, very dangerous pathogens. It was created for the Department of Defense for what's called DARPA. They use it for deactivating anthrax. So that's how aggressive this system is. It uses a type of activated hydrogen peroxide that passes over a plasma arc, and that then makes that hydrogen peroxide active, and that actually deactivates the virus on contact. Okay, so as soon as it touches it, it deactivates it. That's the sort of technology we use in cases where we're disinfecting a building where they know they had a COVID case. So we had buildings that were, our state of Montana buildings and public buildings. We said, hey, we have a confirmed case here. We need you guys to come in and professionally deal with this. We would use that for that sort of technology. For this, that technology is the most in demand in the world right now. We don't use that as a proactive step, but we have other disinfectants that we use that have dwell times of a minute or a couple minutes. But the key is that if it's 5 minutes, it just needs to stay damp. So you pretty much hit the nail on the head, Todd. You would want to clean the surface so that it doesn't have dirt and grime and stuff on it. And then you'd apply the disinfectant, mist it on, and then let it sit, and then come back and wipe it off 5 minutes later. If we were working in, let's just say a hotel, we had a hotel that had a confirmed case. We would go in and you'd start in one side of the room and we apply the disinfectant and work our way all the way around the room. And then you go back to where you started and start to wipe it all off. And it's been over 5 minutes by that time when you remove it.
So I don't expect you to know all of the answers to these, but there's been a run on like Clorox wipes. Are they effective for what it is that we should be doing in businesses?
Yeah, so there's actually two things that Clorox wipe is doing. One, it has a surfactant in it. A surfactant is basically a type of soap that is lifting the soils off, and it's actually lifting a lot of times the sort of what's called biofilm that the virus is living on. So that Clorox wipe is doing two things. It's not only disinfecting, but it also is cleaning at the same time. Now, I don't know off the top of my head what a Clorox wipe specifically, what the dwell time for that is. I suspect that is less than 5 minutes. Now, chlorine bleach, the problem with chlorine bleach is that it's an oxidizer. And as an oxidizer, if you spill it on carpet or you spill it on other natural fibers, you'll bleach them, right? They remove the color from them, which is why a lot of people stay away from using chlorine bleach as a disinfectant. The other problem with it is, like I said, also it's very corrosive. So on certain metal surfaces, it will corrode the surfaces. You would not want to use chlorine bleach on electronic to disinfect it, right? So there's a lot of better disinfectants, but everyone's sold out of bleach because it still has a lot of good places it can be used. Cleaning floors, cleaning countertops, cleaning, plastic chairs in cafeterias. There's a lot of great places for it. It's inexpensive. It's very dilutable. But the takeaway that I hope everyone gets from this is, if you're hiring a service who's just coming in and misting down your surfaces of your building, and they're not following the label instruction, which unfortunately, a lot of people who are offering this service are not applying them according to the label instructions. They have a false sense of security, and that is dangerous and unfortunate. And one of the things you talked about, the Restoration Industry Association, one of the things that we're working right now on is how do we educate the consumer about making sure that they don't get swindled by some charlatan who is all of a sudden a disinfecting expert who really doesn't have any background in that trade.
So there are a number of businesses that are outside the phase one, right? We've got a number of businesses that aren't projected to be able to open until phase two. Some may be even as far out as phase three. I suggest that, coming up with a policy or a set of plans like what you've got here are going to be instrumental, if not key, to being able to reopen some of those sort of businesses. Because not only are we having to kind of instill confidence with our consuming public, but we're going to have to do it with our elected officials and with our health officials in our local communities, right? I think if you're a business that is not slated to open until phase two, and you don't have a plan in place that thinks about where your touch points are and what you're going to do with your employees, when they're sick leave and the health of your employees, right? That's going to be a plan that's written down. It's going to be much more difficult to be able to convince those folks on the local level and a more senior level that you're in a position to be able to open your business.
Yeah, and repetition is really the key on all this stuff, Todd. When we have our system-wide meetings, we record those on Zoom. We record those. We post them on our HR platform so that they're available for anyone that misses those meetings, or if we need to revisit them and continue to train people. We're having to train people for a lot of things that we haven't had to train them for before, and that this stuff is new for everyone. And so anytime we're dealing with new things, to form a new habit takes a lot of time. And, I think it's say 21 days or something like that. So I think to the degree that businesses have plans in place that will establish these as habits, then it will instill confidence in the consumer, which will then, of course, instill more confidence in elected officials and the sort of folks who, in an election year, are pretty concerned about this.
Right. One of the questions that we had come in was wondering, if we have any sort of an idea on when phase one will end. And I served on the governor's reopen task force to kind of put together the recommendations for how to move through the different phases. And the governor was very clear, I think, in his announcement of reopening the state of Montana that he doesn't have a timeline for phase one, right? And that's going to end. And I think he's particularly concerned about seeing some sort of a flare up here in the next 10 days that, could overrun our healthcare system. And so I don't think it's safe to assume that we're going to move into a phase two within a 2-week period of time, which has kind of been the standard number folks use, is that every 2 weeks we'll kind of evaluate whether you're able to move into the next phase or not. And I didn't get the sense that the governor's looking at this in a 2-week increment sort of a process. I think he's going to be looking at what the numbers are at the end of 2 weeks, and may even extend phase one into weeks 3 and 4 if we start to see a bit of a spike in the numbers. And so this information that you're providing us here, and some of this we'll be able to share with our general public here, is that it's going to be particularly important going forward so we don't see some of those spikes as business starts to move into trying to reopen and engage with the public again.
Well, I think, one of the things, again, that is good news on this is that if people and businesses take proper steps and they're careful, we can see very likely this go successfully. I would use, even in our organization, with 130 people, we had people going into homes and businesses. In fact, our business was decontaminating the places that had positive COVID cases. I mean, we're sending people right into those buildings with controls, with proper personal protective equipment, with all of these sort of this infographic we have up right now is one that we put in place 6 weeks ago. But with that, we've not had people get infected in our company. We've had some people who've had family members that have tested positive, but that wasn't from within our organization. So again, if people are careful and if they're mindful as to how they approach this, the good news is that it works, and we can get back to normal with some real common sense approaches here.
There was a point in here that jumped out at me that, you know, now that I see it, it's a little bit common sense, but it's something I hadn't really thought about assigning a responsible party to wipe down all the communal services. I think there's a point here that you can't assume that everyone is going to take that responsibility. You have got to be able to identify specific individuals within your employee base that will do specific tasks and ask them to do that.
Yeah, it's the old adage that, you know, everyone's job is no one's job, right? So yeah, it's having someone that is specifically tasked with that is, you know, is really important. And again, making sure that when they're tasked with that they are properly trained to do it. Disinfectants, every disinfectant that is on that list N that I talked about, the EPA list N, that will deactivate the virus. Every one of those requires a certain dwell time to be effective. So take, for example, if you were to use chlorine bleach, which is on the list N. So most everyone has chlorine bleach. There's some downsides to using chlorine bleach. Chlorine bleach is pretty corrosive. And of course, if you spill it on your carpet, you get another problem that most don't want to deal with. But if you use that, it requires a dwell time of 5 minutes. So if you put the bleach on a surface, a lot of people think that they're disinfecting if they come in and they just mist down the door handles and the countertop and then wipe it off 10 seconds later. Unfortunately, that's not going to do the job. And that's why it's again important that when people are doing these steps, and that's why I recommend if folks have someone who's in their building doing the work of disinfection, that they are properly trained and they're using something from that list. And because nothing would be worse than a false sense of security, that is, our building's being taken care of, and in reality, it's not being properly disinfected. Now, there's the second issue here, and one of the things I would say really is probably one of the most critical things here on this sheet, Todd, is down in the bottom right, and that is we have to be very vigilant to identify when we have folks within our organizations who exhibit these symptoms. They need to be removed from the workforce. One of the things that I was listening to some doctors talk about earlier today is that this is really the first time in history that we are quarantining the healthy people rather than the sick people. And the sick people are being quarantined too, but we're quarantining everyone. But there has been, in the cases where there's been outbreaks or there's been pockets, it's because someone has been sick and they're not quarantined and removed from the workplace. So, you know, that's really important. And then the subsequent piece to that is, how do we handle that? If that happens, what's the next step? So if let's say that I have a bank and I have a teller, and the teller is running a temperature of 102 degrees and they're coughing, so we send them home. What do we do what is the plan? What is our contingency plan in our bank as to how we handle that next step to make sure that the transmission, now that they've touched everything in that area, is dealt with in a way that we don't have it spread to 8 other tellers who then spread that to their families and so forth. So those are really important. And, you know, and no one, there's so much fear around this particular pandemic. Again, the good news is that, you know, 98% of people who do contract the virus survive. So that's really positive. But again, keeping it manageable and making sure that those people are isolated is really key.
Mark, can you talk to a little bit about the difference between, you know, regular cleaning when your business is in operations, you know, hourly, you know, every 6 hours, and then like a pause in like a deep clean? Is there a benefit to, after X number of hours or X number of days or X number of customers, taking a breath and saying, you know what, now we're going to need to go through and do a deep clean? Or is continual cleaning, is that going to cover it from what you're aware of in your work on the National Restoration Industry Association.
And there is, I know again in the resources we can provide, there's some very practical pieces that we have assembled to be able to speak to how this should happen. If I had to take a choice between a deep clean and regular cleaning of high-touch surfaces, I would absolutely take the regular cleaning of high-touch surfaces. And high-touch surfaces, if you think about them, every business is a little bit different. How a restaurant, what the high-touch surfaces they have versus an accounting firm, those are going to be very different. But the ones that are really obvious are restrooms, all of our doors, door handles, countertops, computers, phones, keyboards, or obviously very high-touch surfaces. Break rooms, there's lots of, you have refrigerator door handles, those high-touch surfaces are really important. Coffee makers, everyone, first thing in the morning is going to be going to the coffee machine. We have a checklist. Again, we can happy to provide this stuff to folks, a checklist of high-touch surfaces that we use, but keeping those regularly cleaned and disinfected is, in my opinion, more important than a deep clean. Now, if there is a situation where there's a confirmed case of COVID, in those cases, it makes sense that there would be a much more aggressive approach, because we know in that situation, we're not dealing with a proactive approach, but more reactive, and we need to make sure that that virus that was there is completely deactivated. But it would be it'd be a lot better, again, for the average business to identify that responsible person within their organization, to at every shift change or whenever they have a break. I think in our company, it's, first thing in the morning, 10 o'clock at a break, noon break, 2 o'clock afternoon break, we're going through and hitting those high-touch surfaces. Now, we've been doing that for over 6 weeks now, and I think as we see the number of cases in Montana come down, our vigilance today, I would say, if I was being honest, probably isn't as good as it was 4 weeks ago, but it nonetheless, it's still really important.
So I've got a question here. And this was Leslie, who's the CEO at the Livingston Chamber of Commerce, just down the road from me here today. She asked a question, and I think this is really good from a chamber perspective, is that you take a look around at the chambers in Montana, the area chambers, and a lot of them are in smaller communities. Yeah. Some of them have elderly folks that are volunteering or on a part-time basis, and they're, because they're the primary tourism hub for folks coming into the state. And one of the things that she was wondering about is, do you have any suggestions for best practices around bathrooms in those sort of centers, with the elderly and those sort of folks? I mean, I think there's a general kind of couple of points that you might offer some suggestions here, Mark.
Yeah, it's really important. I think as people come back, there's a lot of things that are really important to address that people are only now starting to even comprehend. One of them, I meant to bring this up earlier, Todd, is we have a lot of people who have been working remotely, and they've taken their computers and their office chairs and maybe some of their office furniture, their phone systems to their homes with them. And now they're bringing them back into their offices. And that certainly presents a risk factor. I think every business should look, there isn't a broad approach that one could recommend for that, because businesses are all over the map with that. I mean, some businesses don't support tele or remote work. Some do extensively. For the ones that do extensively, I would highly recommend that you address that issue proactively rather than reactively, and identify a disinfection protocol before stuff comes out of homes where you may have asymptomatic people who have contracted the virus. They're not exhibiting symptoms, and that could be brought into the workplace. So I would absolutely address that. As to areas like bathrooms and areas where you have the elderly, again, I think it's going to be case by case. First of all, it's going to be case by case. And what would perhaps make sense in some cases where there is high traffic would be to have a restroom identified for higher risk folks that gets more routine cleaning. So, not every facility can support this, but a lot can. They'll have like a family restroom, right? And in those family restrooms, you could more manageably have either your in-house janitorial staff or your hired janitorial staff, or even your in-house staff, if you have people appropriate to do this, if you have maintenance personnel, who address that at certain rhythms or routines that are more regular than the areas that are the more communal restrooms. And so directing the folks who are at high risk, especially elderly, is critical for every business, because those are the folks that have, that particular demographic is just going to have more challenges than people who are in their 20s, 30s, and 40s.
So here was a pretty good question. Is there a difference and some different thoughts that businesses might give if you're talking about a business that has more than like 10 employees or versus those that have less than 10 employees? Right? I mean, probably a majority of the members of the Montana Chamber of Commerce are in that 10 and under employee range, right? Do you see differences in the way those sort of businesses should approach things given a bigger organization?
Well, I think that is certainly something that has to be looked again back to that area as people, as individual businesses. And that would be the thing I would hope every business would be able to take away from this, is that you have to identify the risk that's germane to your business. And every business is going to be different. Certainly a company that has more employees is going to have more risk of transmission. I mean, you just look at the sheer number of human beings that are going to and from grocery stores, gas stations, their homes, all of the different areas that they may have exposure is going to increase with more employees. But rather than focusing on the number of employees, I mean, we haven't seen CDC and some of these other entities have been providing guidance, OSHA, NIOSH, and so forth. They haven't been speaking so much to business size as the segment that the business is in. So looking more at the risk segment of the business is probably more important than looking specifically at the number of employees. I think the number of employees is a factor for sure, but someone who has traffic walking in off the street is going to have a totally different risk profile than a business that primarily is professional with very few walk-in customers or traffic. So that's going to be a much bigger factor. The other factor I think that we'll probably see this summer, especially with tourism, and what I've been hearing is that there's a lot of pent-up demand for tourism, particularly in Montana, and a lot of people want to come to Montana because, of course, we don't have very many cases here, so people want to come here. Is that we're going to have probably as the tourism season begins, we're going to have to take extra and different precautions as we have people traveling inside our borders that are coming from areas where there's a lot more density. And, really from a timing perspective, Montana was pretty fortunate in what we dealt with. I think it's part of the reason why our number of cases is so low is we haven't had people coming into the state.
Hey, Mark, with your work on the national level with the Restoration Industry Association, do you see any sort of certification that might be coming for indicating that a business is complying with cleaning standards? Has there been much discussion around that sort of thing? Because I can imagine a situation where folks would like to be able to put up a sign saying, we comply with COVID cleaning practices or something to that effect.
Yeah. So there's in our industry with the RIA has another organization that it partners with called the IICRC, which is the certification entity for our industry. And they actually are working on an infection control standard. That work was started and underway before this pandemic. I think this pandemic has accelerated a lot of the work of the task forces that are doing, really preparing some of the standards, which then drive the training and the education and ultimately the certification process. That is really geared to our specific industry rather than to a business trying to certify itself. There really isn't any sort of you know, you think about the certifications that businesses can get. Take, for example, the LEED certification. You know, we don't see as many of those in Montana, but, you know, being LEED certified is kind of the green building certification that some businesses pursue. You know, it took like 10 years for the LEED certification program to make it into a formalized program from its kind of initial concept stage to actual implementation. So I think it's very unlikely that there will be a certification program on a national level. What I think is possible, I'm speaking with the Better Business Bureau here, I think next week or at some point here in the near future. It's possible that some of these organizations like the Montana Chamber or a Better Business Bureau or someone like that could develop, and I know I talked about this with you earlier when we were talking earlier, to develop some best practices and policies that businesses could adopt to say, we have done that, we are familiar with these processes, we're utilizing these daily, we use some sort of mechanism to ensure that we're doing it daily, and we can build that level of confidence with the consumer. And I think that's really what it all comes down to, is how do we build confidence with the consumer that we are putting their best interest, their health and safety, really at the forefront of our decision-making process. And so that really, I think, is an area of opportunity. I don't see anything happening nationally in the next, some of the stuff that we've been able to collaborate on for best practices just amongst our industry have been unprecedented. For example, we were able to collaborate to bring some documents to the industry that normally would take years to do in days. And it was kind of an interesting thing to see happen in our industry, because normally there's a lot of bickering on this stuff, you know, in turf wars. So that was really nice to see. But I think it's going to be a while until businesses could individually certify.
Yeah, you know, there's a lot, because every business is so different, you know,
Yeah.
with different business sectors. So I'm working with some health club folks today,
Right.
and the Billings YMCA.
Yeah.
And health clubs, you know, were specifically left out of phase one.
Yeah.
And so, you know, they're wondering why they've been left out of phase one, because, you know, they're looking at, you know, they can social distance within a health club, and they've got the cleaning standards that they can follow. And so I've been encouraging them that while they don't have an association of health club owners in Montana or some sort of affiliation like that, I've been encouraging them to try to work together instead of competitively, to try to develop some best practices that they can broadly agree upon, and then that should be able to provide some sense of comfort to the governor's office that, you know, health club owners have got a handle on this thing if they're allowed to start into the reopening phase. The Montana Tavern Association and the Montana Retail Association, they went together and they did some collaborative work on trying to identify best practices. And some of the things that they thought about that they're changing their business practices is really quite startling. It's things that, you know, unless you're in that business, you wouldn't even really think about. But that industry segment, you know, really tackled this from a really unique standpoint. And they tackled it from a collaboration sort of a standpoint. And we had a question here about museums, you know, like, when do we think museums will open, you know? And while I don't have answers for that, I think that if businesses and nonprofits can look to adopt best practices from wherever they can adopt them and apply them to their specific business, I think we start building a case that more and more businesses can open quicker, or we can move through these phases more quickly.
Yeah, and all of it's going to come down to, I think, again, the context of the communication that we have internally and externally. To the degree that you can communicate internally about the process that you went through to prepare. Again, every business is so different. To the degree that they can then put together a thoughtful plan, get it in writing, communicate it to their team, let their customers know about how that plan is being executed, and then have it drive through the procedures that they have in their company that happen all the time, day in, day out. That's how we stop this, and that's how we can have Montana be a success story as one of the early states that opened, and that wasn't as impacted, got back to work early, and then saw this continue really to go down. but it's really important because to the degree that people are, either fearful or unprepared, we could see an outcome in those two areas that isn't going to be conducive to where we want to get to.
Great. And I had a question that was more aimed at me, Mark, and it was a question about childcare. And we are in an unusual situation here now where, if you've had a business that you've had to furlough folks or lay people off and due to the COVID, and now you're thinking about bringing them back, well, school's out. And it looks to me like most of the schools around the state are not going to go back into session between now and the end of this school year. I think kids are home. And so trying to bring parents back into the workforce when they have school-age children at home that aren't old enough to be at home by themselves, it's going to be harder to try to pull them back into the workforce. And so there's a lot of discussion around what do we do in this interim period of time. And there was a question that was asked to me about, are we going to be advocating for more resources for childcare? And I think it's going to have to be part of a longer-term solution here, or I shouldn't say longer-term, maybe a medium-term solution before we can get our workforce fully back on board here, because these are just new challenges that we're all facing here. So I don't know what you're experiencing on your end from your employees. You've probably been rolling along busy as
that's a very real issue that we have because we do have people within that are on our team who all of a sudden they have this challenge with childcare. How do I care for my kids and still have my job? And so, this crisis has required a lot of understanding, patience, and compassion. I think every business owner has to look at these situations case by case and, try to, as we have with our teams, this within the crisis, there comes this area of opportunity, for us to be able to help each other out. And I think probably to see, a lot of people connect on a deeper level than they did before. We're talking with our business development team earlier today. A lot of people just want to talk right now because they don't have people to talk to. And so being able to, as not only entrepreneurs who are driven to be successful in our organizations, but still to be able to honor the other human beings we're working with is really important.
Hey, Mark, are there any legal liability issues that we need to think about when it comes to disinfecting businesses and cleaning, or are there any things that you're kind of hearing about that would be worthy of us to know about?
Yeah, it's an excellent question. It was one of those areas that I was really reticent to dabble into because it is Pandora's box here, right? We get into the legal and the insurance side. There's a lot of challenges. Again, every single business has specific challenges that they face. Here's a couple things that I would offer. Well, first of all, is you should absolutely have a discussion with your insurance broker about your current coverage that you have for your general liability insurance and the other insurances that are appropriate for your business, and to make sure that you have coverage for this specific issue. Many businesses do have coverage for this specific issue, not all, but many do. That probably will be excluded in the future. It's hard to say. I'm not an insurance agent or an insurance expert necessarily, but I do deal with insurance companies quite a bit. So that's absolutely a discussion that should happen. As to the issue of legal liability, I think any jury is going to look at a situation. If there ever were a trial, there's something that went to trial, they're going to look at what steps did the business take and were they reasonable steps that they took. I think right now in this pandemic, if a business was not taking steps to keep their business clean and to disinfect it, the surfaces in there and following those sort of steps and guidance that we outlined earlier, that would be perceived, I think, by most to be negligent. Yeah. So I would suggest that, there's some people that have said, well, I don't want to disinfect my building because I don't want to be liable. Well, you probably have more liability. From just the standpoint of practicality, if you were in front of a jury of your peers, not doing that would probably be a lot worse than any concern you'd have about actually doing it. Now, if you are going to apply disinfectants, again, there's risk in applying them in a way that's not consistent with the label. So that would be really important to make sure, and that would be really more of an OSHA issue if you were requiring your employees to do this instead of hiring someone else, like either a janitorial restoration company to do it. That could be problematic in that regard. And that's why I said, if you have a janitorial cleaning service, you should absolutely make sure that that's part of their protocol moving forward. And if you do have not only that, you should also probably have a protocol in place for if we have a confirmed case, what do we do? How do we handle that confirmed case? And then you probably want to deal with a professional who actually has the technology to deal with something that's pretty aggressive.
Yeah, I think I think we're up against the hour here, and I think that final answer really kind of brought full circle the importance of kind of putting together these 4 Ps, right? Is that as we go forward, right? I think those businesses that don't have a thought out plan, haven't prepared for this, don't have the policies and procedures in place. If we see another outbreak, which I think it's safe to assume we're going to see another one, right? There's going to be folks looking to extract from that, right? And there's going to be a liability. There could be a liability associated with it. So I think that was a really good point. And as we wrap up here, Mark, I'm going to give you a final word, but I wanted to say thank you. I read there that you had disinfected all the first, well, I don't want to say all of them. You disinfected a large number of the first responders' vehicles here a weekend or 2 ago. In places like Helena and Missoula and Bozeman. You did that free of charge. And I was not as acutely aware of the risk that our frontline responders have as they do until I got to visiting with some of those folks that work in work in our police departments and our fire departments and some of the exposure risks that they have. And so thank you for doing that, right? That's a great example of Montana coming out and supporting Montana. So I just wanted to say thank you. And with that, if you have any other words, I'll leave that with you, and then we'll get ready to wrap it up.
Yeah, no, well, again, Todd, I appreciate you opening up this. I think it's a really important topic. I know we did it really on short notice. So my goal here today was to be able just to really prompt the thinking for folks, because our experience has been that all of the solutions that you need to incorporate into your business are specific to your company, but they fall within these general framework that we provided today. And my advice to folks as they go through this, because I know we have a lot of entrepreneurs on a call like we have today, which means we have a lot of leaders on the call. When we crisis, someone said, your character isn't determined, or you don't build character in a crisis, rather a crisis reveals your character. And so I think for all of us, one of the hardest things that we face as entrepreneurs is this uncertainty and the fears that come in. A lot of us have, personal guarantees on loans, and we have big financial liabilities and all this other stuff. And fear doesn't always bring out the best in us as leaders. And so I just encourage everyone who's on here to hang in there and look at what we face right now as a unique opportunity, really to be able to bring a lot of hope to a lot of people. I think it's cool that Montana gets to be on the front line of this. We start working here again. I think Montanans are pretty proud of being Montanans, and so just encourage people to be serious about the what's in front of us right now, and approach this as leaders approach it thoughtfully in a prepared way, emphasizing the way that we communicate.
Thanks, Mark. And Mark's been gracious enough that he's going to work with us. Hold on a second. I keep getting that unstable internet. Can you hear me now okay, Mark?
I got you loud and clear, Todd. Yep.
Okay, great. So Mark has been gracious enough that he's going to work with us to kind of package up that those 4 Ps, and we'll put that out on our website so that anybody that was here can access that. We may send out a reminder to folks when that's available. And so I want to thank Mark for this. Next Wednesday, I think it is. Yes, we're doing a similar one of these with Blackfoot Communications to talk about cybersecurity risks and what businesses should do to protect to protect them from being hacked or malware sort of threats from the cybersecurity world, especially as we continue to move more solidly into the telework world that I think is going to be more of the norm than it is the exception going forward. So thanks again, Mark. Thanks to you at Dayspring Restoration for all you're doing on this sort of thing. This has been a wealth of information. We appreciate it.
Thank you, Todd.